What do you think the most rewarding tactile experience is for someone in medicine? Meaning something you experience through touch. Is it getting an IV through the skin? Is it getting an endotracheal tube to the vocal cords? Is it getting a needle into the pleural space when you're decompressing the chest? I think the most rewarding tactile experience is something that most of us have never done, which is manually defibrillating the chest with paddles. There is a real dopamine rush to holding those paddles in your hands. You feel empowered. And then you rub that gel on the paddles and rub them together, and you place them on the patient's chest, and you charge, and boom! I don't think there is any feeling like that in emergency medicine. This is something that I wish everyone could have experienced. I've done it exactly one time, but there's a really good reason why we switched from paddles to pads. And it was all because of this small 1987 paper that compared cardiac arrest performance and outcomes in an urban EMS service between patients that were defibrillated with paddles and patients that were defibrillated with pads. DEFIB was terminated more frequently with pads, and this was particularly true with the first shock. More patients survived 30 days with the use of pads, and there was less artifact with use of pads, which resulted in less unnecessary shocks. This also turned out to be safer for the provider. Defibrillating with paddles results in a higher opportunity of contact with the patient. It's safer for the patient because the more consistent pad contact resulted in less arcing and less opportunity for a burn to the patient. And two big benefits from this are obviously continuous monitoring from the moment that you place the pads and less disruption to CPR. Now, there is a belief with a little bit of supporting data that properly applied paddles with appropriate pressure lessens impedance as compared to pads, but there's no data to suggest that this is resulting in higher survival, so it's not a compelling reason to use paddles instead of pads. But some people do apply pressure to the pads during a defibrillation using like towels or double gloves or something like that. I'm not recommending this practice, but it is performed. And I will post a link to that landmark study in my bio.